Welcome to Living Vividly, the podcast where health, wellness, and curiosity collide. I'm Jackie, the founder of Vivid Health and Wellness, your guide on this journey to living your happiest and healthiest life. My co-host Daphne, the unconventional dietitian, is always ready to shake things up and bring a fresh perspective to your wellness journey. And we can't forget Dustin, our producer, who keeps everything running smoothly behind the scenes. Together, we'll chat with health and wellness experts along with everyday people who have inspiring stories and practical insights to share. If you're ready to nourish your body, move better, and discover simple ways to thrive, you're in the right place. And hey, if you enjoyed today's conversation, don't forget to leave us a comment sharing your thoughts, and subscribe so you never miss an episode. Welcome back to another episode of Living Vividly. We're excited to welcome Dr. Michelle Carr to the podcast today. She's the owner of Carr Chiropractic right here in Lafayette, and someone I've gotten to know and admire over the last few months. Dr. Carr is a board-certified chiropractor, a passionate wellness advocate, and a female business owner who's built an incredible reputation for helping her patients live pain-free and aligned through a personalized, holistic approach to care. She's been part of our Health Revolution community from the very beginning. She's even attended our very first event, and I'm thrilled to have her on the show today. We're going to talk about what chiropractic care really looks like, the mind-body connection, and what it means to be a woman leading in the world of wellness. I can't wait for you to hear her perspective on healing, movement, and how our nervous system plays a bigger role than many of us realize. Thank you so much for coming today.
Thanks for being here.
Really
it's my pleasure. Thank you for having me.
So how long have you been a chiropractor?
Almost 20 years, right at 20 years. And that is hard to believe at this point. Time has flown by, but it's made it interesting. So
how have things changed from the time that you got into it to now? Because I feel like this wellness world is kind of blowing up right now.
Drastically. When I first became a chiropractor, or when I was looking into chiropractic care as a career path, there may have been 10 chiropractors in Lafayette. I don't believe there were any women.
Wow.
So, again, black sheep of the family here. I was, if you want to say crispy crunchy, before that was cool.
Yeah.
I just had a different mindset, and I wanted to explore health and wellness from a different perspective. So when I went to chiropractic school, I was one of the only females. There were a few of us, but not many. And the guys would look at you like, what are you going to do, little girl? And I thought to myself, well, I'm going to show you what I'm going to do. And over the years, things have changed. I've seen so many more females, and also the career path of chiropractic itself grown as far as being a respected profession.
Mm-hmm. Yeah.
It was not so much that case when I began. So
I can remember as a child, my dad had, both of my parents actually have lots of back issues, pain issues. And my dad was just like, chiropractic, that's quackery.
Mm-hmm.
I'd never go to a chiropractor. And I think that was the theme for a long time before it became, a possibility that perhaps a chiropractor could help you. What got you into, what put you on the path to want to become a chiropractor in a world where, your world was very different from mine because there are very, very few men dietitians. I was amongst all women where you were complete opposite. But what got you into chiropractic school? What led you down that path?
I love to tell this story because it's very personal.
Okay.
I had my eldest son, my son Andre, at a very early age. And, like every new mother, no matter what age you are, it's all new to you. You're not sure how to cope with everything, all the changes going on with your body. Unfortunately, I had to have an epidural. And after the epidural, I had extreme severe back pain. Went to the medical doctor. Here's some painkillers. Here's some muscle relaxers. Those were my only options. So what did I do? I took them because we listen to our medical doctors.
Right.
They know what's best for our bodies.
Especially if you have no other option and you're in pain.
Absolutely. So I did that. Of course, I couldn't drive. I couldn't work. It was very difficult taking care of a newborn. So a friend of mine was actually in chiropractic school in Houston. And chiropractic, what is that? What do they do? Because I do not come from a health and wellness background family. No one in my family saw chiropractors. So I thought, well, it can't hurt. Let me go check it out. And after a couple of adjustments from him, it literally changed my life.
Wow.
The back pain went away. I started seeing a chiropractor regularly at home and started exploring that as some type of avenue to take with my own career. Because at that time, I was a personal trainer. So it always interested me, the anatomy, health and wellness, staying fit and healthy. But sometimes you also have to pay your bills.
Right.
So
always.
I learned very quickly that something else, would have to be done in order for me to take care of my family. So I started applying at chiropractic schools and got accepted and started on that path.
And so did you open your own chiropractic clinic right out the gate, or did you work with another group of chiropractors first?
No, I'm sure each physician would tell you a different story or give you some more advice one way or the other. For me personally, I knew that I didn't know anything about running a business.
Yeah.
Taxes. What do you mean I need an accountant?
You mean they don't teach you that in chiropractor school?
Absolutely not.
Yeah.
They teach you how to adjust and how to be a chiropractor. They don't teach you about customer service skills, finances, and all those things that are very crucial to running a business. So to answer your question, no. I went and worked for other chiropractors here in town in Lafayette. And some of those were good experiences. Some of those were not so much. But like every experience, you chalk it up to learning something, whether it's something you want to do or something would not be best for you.
Yeah. Okay, who were the worst? No, I'm just
kidding. No, it's true.
My lips are sealed.
Those lessons, especially early on in your life and your career, those are very important for building up, especially now that you are a business owner. I'm sure that still plays a role in how you manage your company.
Absolutely. And I'm sure you guys are familiar with Mr. Red Laurel. Rest in peace. One of my absolute inspirations and a mentor for me. When I was in college, I worked at Red's. And sometimes Red would come and sit and have lunch with me. And he would always give me pep talks about, you can do this, get through school. You can do anything you put your mind to. And I really listened to that. And I needed to hear that from someone other than a family member.
Right.
Someone who I looked up to and just really aspired to be like. And it really did help to hear those inspirational words from him.
It's so cool that you were a personal trainer before, because it gives you almost a deeper understanding of the body from a different perspective.
Absolutely. And injuries also, the bodybuilding world itself, people tend to push themselves. And when you push yourself, you tend to cause injuries. So I got to experience how that affected people also as a whole. Again, life is just full of experiences and we can either learn from those or not. But I kind of tucked that information in my belt and I thought, okay, this is going to help me later on. So it was one of those stepping stones.
Whenever you say that chiropractic is getting adjusted, what exactly does that mean? I mean, I think people have their own idea of what that means, but explain to me from your perspective what it means to get adjusted.
Well, as far as chiropractic goes,
tell me any kind of way you think about it. Well, but I mean, chiropractic for sure, but all other aspects of it too.
Attitude adjustments.
Exactly. I can't help with those, but if I could, I'd be a millionaire. Hasn't happened yet, but technically, getting adjusted is either gentle, like a finesse, to move the spine, whether it be through a musculoskeletal approach or with more of a thrust, with either a rotation or not so much. You don't, the misconception that I see a lot is that people think, unfortunately, with all these TikTok videos going on, I understand it's a marketing ploy, if you will, with a lot of people. However, it could put a bad taste in a lot of people's mouths because it's not about the sound. It's about the movement. And as we all know, movement is medicine, whether it be cardiovascular or something more chiropractic or physical therapy or dance or any of those things. Movement in that way is healthy for us all.
So you're moving and adjusting the actual spine.
The vertebrae, yes.
But there's no guessing in the adjustments you're making. You feel to see what's out of line and then push it back to where it should be.
Basically, for my office, there are some offices that just have people walk in and they get an adjustment on that first visit. For my office personally, we do several orthopedic exams. We touch on some neurological exams and I take x-rays. So we also see visually the positioning of the bones. It's not just only feeling.
Gotcha. So some of them, like you're saying, they do we'll crack your back or we'll adjust.
Crack is a bad word. adjust.
Right. But
But it does crack.
But what I'm saying for the other offices that don't necessarily check all that, you just want to feel better. Like, okay, yeah, well.
I'd have to disagree with that.
Okay.
I'd have to disagree because there are some things that can occur in the body. And if you can't see on an x-ray, it could be detrimental to someone to get an adjustment.
Okay. So most check first to see what's going on.
Most, I would hope so,
Okay.
yes. I certainly do.
Well, without an x-ray, you're really just guessing, and that's dangerous.
Well, being a chiropractor and anyone in that field should have a very heightened sense of touch. Very heightened. I know when I was in school, we had a professor. He was kind of quirky, but I do remember him. He would have us stick our hand in a cardboard box lined with a garbage bag, and there would be individual bones. And we had to feel and describe which bone and identify which bone it was and whether it was on the left side of the body or the right.
Yes.
Wow.
But again, that
So,
proves,
like you said, a heightened side of touch where you're taking the visual part of it out,
Exactly.
and so you're really just relying on the feel of what it feels like.
So X-rays are good because there's the visual, but also we're trained with touch as well.
How does it affect your nervous system? So once you get adjusted, what happens? What does that do to the nervous system? Because we know it's all the spinal cord is the column. I mean, I'm sure you would describe it differently, but like the tube essentially that houses the nervous system or part of the nervous system up to the brain.
All the vertebrae that make up our spinal column are really there to protect the soft tissue inside, which is the spinal cord.
Okay.
The spinal cord, as we know, communicates with the brain and helps our bodies get up and go every day and move and breathe and work out and all those things that we enjoy. However, if we break it down even further, the spinal column itself is broken down into separate sections: cranial, cervical, thoracic, lumbar, sacral, coccyx. You may have heard these terms here and there. But between those groups of nerves, they actually exit the cord and go out into the body and innervate every system and every organ of your body. A lot of people don't realize that. They think they're going to a chiropractor for that audible sound. That's not what's helping, and that's not what is relieving. However, there are things called mechanoreceptors along the spinal column. And so when those bones or vertebrae are moved or shifted, it actually sends a pain relieving signal through the nervous system. It may feel good immediately, but it's not necessarily healing something. However, it is stimulating the nervous system. Whereas if there is an issue elsewhere in the body, with the lungs or gastrointestinal issues or whatnot, it could help relieve that pressure or the innervation to get there smoothly and how it should.
And by the word innervation, you're meaning like the actual nerve, the way that the nerve sends signals down the column.
Exactly.
Or down
the communication between
nerve.
the spinal column and the actual spinal cord and into the whichever organ, we're discussing, which level.
That's incredible. So you're not just worried about, obviously you're worried about the alignment of the spine, but it's affecting other things, other systems in your body.
Absolutely. The entire nervous system.
You mentioned neurological testing before you get started. What does that entail? And what are you looking for?
Well, it entails simple reflexes. If the reflexes do not communicate effectively, that's a brain-body connection.
This thing?
That's
everyone's favorite. I love it so much.
But there are others.
What are some others?
Well, we have a brachioradialis reflex.
Oh.
Big word, I know. But anyway, it's just that communication between the brain and the body, the spinal cord. So we do reflexes. We use something called a pinwheel. Have we ever heard of that term? A pinwheel is...
Yeah, we used to make them in school where it's like you blow on them. Exactly.
Not that kind.
Oh, okay.
I should have brought one.
Oh.
We could have learned something. But
it's okay.
Anyway, it's one way of tracing the specific spinal pathways that come from the spinal column. So whether there is something affected in the upper trunk, the cervical spine, head and neck area, those nerves go all the way down our arms to our fingertips. So some people come in and say, Dr. Carr, I can't feel these 3 fingers. I don't know what's going on. I need you to adjust something. That tells me specifically which area of the spinal column and which nerve is needing more attention, basically.
So by the symptom, you see the symptom is here, then you do x-rays, you see the x-ray is, this is what happened with me whenever I saw Dr. Carr a while back. She told me that I had to do some chicken stuff because my neck is not strong enough to hold the weight of my head. These are not your words. Because my brain is too big, essentially. That's what I deducted from it.
Yes.
Is that the nicest way anyone can tell someone that they have a big head?
No. The human head weighs as much as a bowling ball.
Yeah, my memory and interpretation of this was several years ago. But by I don't know that I went in there with any specific. I did. It was neck issues, which is common because of the way that I sit and the way that I sit at my computer.
It's the world we live in.
Yeah.
Not because you have a big head.
No.
And also because I have a big head with a big brain. That was the other side of it, that she just knew that I already knew that part. So, but so going back to the can't feel with your fingers, you can't feel. So you're already thinking, okay, I know exactly where to look for this. And then you get the visual confirmation, and then you can do the adjustment as needed.
Yeah, so we do that on the upper trunk and the lower trunk, because the lower part or lumbar spine and the spinal nerve roots that exit in that area innervate or communicate with the pelvis, the legs, and all the way to the toes. So you may have heard of the term sciatica or, my L5S1, I have a herniation there. It's just one of those tools that points us in the right direction and where to focus.
Not all your nerves go from your spine to other places. There are nerves that exist alone that don't go all the way to your spine.
Right. They're dermatomal levels. They're cranial nerves, but we're getting pretty technical there. But we do cover
but a
all.
large amount of them come from your spine.
Yes, I do like to mention this. A good chiropractor, when they know they can't help someone, they need to refer out. And thank goodness I have a great network of professionals in my circle that when I know this is not within my scope, this patient needs more or needs to co-manage care between my office and theirs. And things have changed in that respect as well. Mm-hmm. I've seen a lot more open doors for chiropractic care.
Yeah,
that's interesting.
To manage patients together.
To manage patients. It's about the patients. It's not about our egos. It's about the patient getting better and getting the care they need. Mm-hmm. That is what we took an oath for when we graduated, and we're out there in the community. So again, it's changed quite a bit.
Daphne said something really enlightening a couple episodes back about how all these different modalities and these different practitioners and providers are looking at the same patient from different angles, and we're all kind of shining a light from a different angle. And whenever do you remember saying that, where you shine the light from all the different angles, you can actually see everything? And that was such a cool analogy, because it's so true. If you think you're the only one that can help this patient and you tell them not to go to anybody else, we're missing out on so many different parts of their,
Run. Not everyone knows everything. And you should get to a point where you know that, and that you put the patient first, basically.
That's what we're all here for. As practitioners, we're here to every person that you help in whatever light that you're shining on them, and you refer them to someone else that can further help them. What it's doing is it's up-leveling our whole community, because the more people that are helped and feel better and can be the best version of themselves, then we become a better community because of it. Not just a wellness community. A healthier community, but we become better versions of everything that we can do for the community. From a practitioner standpoint, like, I know what I can do, and there are limitations to that. So when I reach that limitation, then, or even when I'm getting close to that limitation, then letting someone else shine their light so that they can improve the person, so that the person can become a better version of themselves.
And that helps the providers too, because you're learning from your peers, but it's also, as I'm just a lay person who is...
Stop calling yourself just a lay person.
But I'm not a doctor.
So she lays a lot.
I do lay a lot. After this podcast, I'm taking a nap. But we're demanding more and we're learning more. So it's really cool to see this movement happening where we're taking control of our own health. We're advocating for ourselves better. And we know, my GP might not know everything. So I need to go see a chiropractor. I need to go see a dietitian.
Question the answers. I always tell my patients that. They say, Dr. Carr, they only spent 10 minutes in the room with me. I saw this person instead of the doctor. They didn't give me an opportunity to ask questions. Continue asking the questions. Yeah. And if that, facility isn't the right place for you, find the one that is, because that's what we're here to do.
Yeah, I think there's like this emotional, I don't know why we do this, but we almost feel embarrassed to break up with our doctor or to question, just to go to someone else. Like, you're not locked into these relationships.
I always describe it like if you have a toilet that is overflowing, that's an immediate emergent response. If you call a plumber in and the plumber can't, they're like, get you sort of halfway there where it only overflows like every other time it flushes. It still didn't do the job it needed to do. So you're going to call in another plumber. You wouldn't just be like, oh, well, I'm married to that plumber. He can only fix it halfway.
Better pay him again.
Yeah. You find another plumber. So our bodies are kind of the same way. Our bodies aren't overflowing like a toilet, but when there's an emergent situation or even not emergent, if somebody can help you, that's great. If they can only get you to a certain extent, then you have to find someone else that can help you. But we also have to take control of the idea that we deserve to be helped too.
Absolutely. Take those steps. Put yourself first.
Put yourself
and
first.
your family's health.
I've heard this in different ways before. So like chiropractic healing the common cold or like symptoms of eyesight or hearing or whatever, is that back to you being able to trace what's wrong? Like, oh, your
Through
third
nerves.
vertebrae is out of place. That's why you can't hear anything. That's an extreme, but is there something there?
Well, that may have come about. D.D. Palmer is named the father of chiropractic. I don't know if you guys have heard of any of this. And that's how the first chiropractic adjustment was really documented, because he actually adjusted a deaf man and restored his hearing.
So there is some basis to what I'm saying.
There's a basis there, but I would never claim, hey, you have the common cold, come in, I'm going to adjust your C2 and you're going to be better. It's a boost in the nervous system, which boosts the immune system.
Gotcha.
There's not one specific adjustment. And if there is, I don't know about it.
Okay. So it's not like your left arm is out of place, that's why your right eye is blurry, or there's no like that direct...
Well, there may be something to that, but common cold and deafness and blindness, that's different. That's different.
Okay.
What I think is interesting is that we know, it would be common thought to think, okay, my arm is numb, so let me go see a chiropractor. But our nerves also innervate all of our organs too. So if you have some liver dysfunction, perhaps chiropractic can help you with that. Or, if your digestive system, anything from gastroparesis to dumping syndrome, like chiropractic can help with that because it is adjusting the nerves that surround those organs. So if it's a limb that feels a little numb or a little pain, that's one thing that we always associate chiropractic with. But whenever we're talking about how our organs function, that's something that we don't usually think about chiropractors being able to help with.
Right. I see a lot of children for asthmatic issues because the innervation in the thoracic spine innervates the lungs.
This is what I was looking for.
Okay. And also we see patients, I know you wanted to talk about this whole time, constipation.
Yes. I knew we'd get there.
Dustin got
just
his
for you. We do see patients that have constipation issues that affects the lumbar spine. So it's amazing to think how the body...
And that makes sense, because I have heard like yoga helps with digestion in certain ways. And I guess it's the same idea of the...
Yes, yoga's wonderful.
Yeah, of the
movement is medicine.
Do you work with gastroparesis much?
I haven't seen that much, but I believe that's because people don't
think
generally
about it.
know that we can help with those sorts of
That's
things.
not a connection that most people think
they
about.
don't. They unfortunately
that?
now it's TikTok and come do the ring dinger and all this other stuff, and it's like, no, we don't do that here.
Gastroparesis is the paralysis of the stomach. Like the stomach doesn't have the nerve function to be able to push things through the intestines.
That sounds like a major problem.
And I believe
in fact, a major problem.
the reason people aren't educated so much in chiropractic care, especially in our region, another fun fact, you may have already been told this, but prior to 1974, chiropractors were being thrown in jail in Louisiana.
Really?
Yes. We were the last state in the nation to become licensed in chiropractic care. Thank you, Mr. Edwin Edwards. Rest in peace.
So it was like under the table chiropractic that had to be done?
Well, it was being called practicing medicine without a license. So the medical community would have these people arrested.
Because there was no Louisiana license.
There was no Louisiana license, but everywhere else in the United States of America had licensure, except our state. So the mindset to begin with in this region is behind the times, I believe.
It's quackery.
So yes. And guess who bailed those people out of jail? Those doctors of chiropractic. Who bailed them out of jail?
Very interested to know.
Their patients.
Oh, wow.
Yeah, because they believed in what they were doing.
Because they helped them. They relieved them of such pain and changed their lives in so many ways. And that proves it right there.
Well, there was a huge campaign to vilify any alternative treatments for a long time. And we don't need to go down this rabbit hole too much, but the whole Rockefeller thing, pretty sure that's who it was with the pharmaceutical medicines, just turning any alternative treatment into quackery. And
that's
it's really a shame. I'm really glad that we've turned it around.
We're turning it around.
Yes.
It's definitely
questioning those answers.
Yeah.
Just to be clear, I don't know everything about chiropractic. The reason why I knew D.D. Palmer, is that what you said? So in our episode with Dr. Shute, he talked about how the first chiropractor came out of
I'm so glad he knew
first
that. Good.
doctor of the osteopathic doctor. One of his patients became the first chiropractor. So that was that connection.
Yeah.
It wasn't just a fun fact that I happened to know. You mentioned sciatica. That was something that I struggled big time with my first pregnancy.
Can we define that before we get too far?
Yeah. So what is sciatica? How could I have made my life easier for 9 months looking back?
Going to a chiropractor.
Okay.
That's the easy answer?
That is the easy answer. Sciatica, what most people think of sciatica is radiation of pain, either burning, numbness, or tingling, coming down from the low back to the buttock area down into one of the legs, basically.
Along the side, the back, the front?
The back of the leg, yes. So it can cause...
I mean, my legs would give out when I was walking.
Yes.
Wake me up in the middle of the night.
Like a vice grip. And the sciatic nerve is about as big as your index finger.
Holy cow.
A lot of people don't realize that.
So the pain is coming from what's going on with the nerve, like a pinch of the nerve, or?
It could be a compression of the nerve. There's a small, thick muscle called the piriformis muscle that kind of entraps that piriformis nerve. And if you sit too much, a lot of my truck drivers come in and they have sciatica because they sit in a certain position for so long every day. And it entraps and turns that little piriformis muscle into a vice grip. And once it gets tight and causes that tension on the nerve, it's very hard to release. And with expectant moms, again, the pelvis is moving and shifting, preparing for birth. So those muscles and everything around the pelvic area is shifting as well. And it can also cause some type of tension on the nerve there.
For 9 months, I was just miserable. And as soon as my pregnancy was over, it dissipated, which was wonderful. But
so there's nothing she could have actually done other than go see you?
She could have done some stretches.
Okay.
Generally, stretches. People in general, I tell all my patients, if they would listen to me and stretch more, I wouldn't see them as often, but I can guarantee and bank on it that why do people not want to stretch? I don't understand.
I will tell you why. I hate stretching. I hate it so much. I did this morning. I foam rolled this morning, which is very unusual. That's just because my schedule's all thrown off. But so I don't like stretching because, and it's not that I don't like it, it's just that it's extra time. And so I've tried to make it a habit that if I'm sitting around in the evening, I'm not good at stretching. Even whenever I ran a lot, I would stretch very little, and I have very tight hamstrings. I mean, I know all of this about myself. So,
self-awareness.
Yes.
That's number one. So I'm trying to make it more of a pattern whenever I'm relaxing in the evening to include stretching in that time. So I'll sit on the couch and like stretch, yoga type stretches. But it's just because of the time, because I live on a very tight, my own time crunch always. And so stretching's just like, I'll do that later.
You're not alone. You are not alone.
Well, and it's weird because like even with my exercises for PT, it's like, I'll do it when I have time. It takes me 10 minutes.
Right.
what is I just sat here thinking about doing it for 10 minutes.
Right. You could have been stretching this whole time.
That's what I was thinking about that while you're saying, like, what could I be doing back here to stretch?
You're absolutely not stretched right now.
No.
You're all crunched up into a ball.
Yep.
I usually tell my patients, I give them a handout and I say, put this on your refrigerator. And every time you go to peek in that refrigerator, here's your reminder. Put a copy of it on your mirror in the bathroom. Another reminder. Other than going home with them and fussing at them, put a copy next to the bed and don't let yourself get comfortable until you do your stretches.
So what exactly is stretching doing?
Like, is that helping align your spine?
It can lead to my job being easier, for sure. And it can stop the general public from having to see a chiropractor as regularly.
Is it because it's when you're stretching, I'm thinking about it. I think of stretching as being more muscular related, which obviously it is, but is it because there's a nerve stretch too? Like, what's happening whenever you're stretching?
Well, the muscles themselves are made up of many, many, many fibers. And so if we have, say you sit at a desk at a computer all day, which
I do.
We all do.
Everyone. You sit in that position and the muscles can become tight. So those fibers also generally become tighter and the little spindles of fibers become tighter. It could be maybe more on one side than the other. So if you continue to stretch either because of pain or because you listen to Dr. Carr, it can help the imbalance of either the pelvis and in turn the spine itself. Okay. However, I can give you a great example of a patient. He was, I guess, in his 70s. His parents were still around and they were in their late 90s in a nursing home. They had both been wheelchair bound for years. And he decided, I'm not going to end up like them. I'm going to fight this every step of the way.
You're talking about the 70-year-old.
And I took x-rays of his spine. And it was hard to digest because I had to walk into the room. And this gentleman did yoga 6 days a week. And he ran and worked out. And
was fine? Like, he wasn't in pain?
Was not in pain.
Okay.
His spine was riddled with arthritis. Fused, natural fusions of the bone. Looking at that x-ray, you would think this man can't move. He's going to be in a wheelchair in a couple of days. Do you know he could bend over and put his palms on the floor backwards?
Wow.
Because he continued to stretch every single day. It's insane, but it shows you what can happen.
It's possible.
If you choose to be proactive with your health.
I promise I'm going to start stretching.
I'm holding you to that.
I promise. So both parents have rods in their back and their spine fused in different places. My dad was more because of hard labor. Like, he did a lot of hard labor, and remember, he was not interested in chiropractor care because that was like quacky. And then
they were getting thrown in jail in his time.
Right. Well,
can't blame the guy, right?
But I mean, he honestly just didn't take care of his body. And then my mom, I'm not exactly sure what my mom's was, but both of them have rods in their back and obviously have very limited mobility because of it. So I promise I'm not going to become one of them. I know I said that a long time ago, but I guess I'll start stretching.
Let them be your example. And I tell all my patients, you can't pick your genes. Our genetics are set, but you can surely fight against them and do proactive things to take those measures to ensure your health in the future.
Yeah.
It's so hard to think about when it's not a problem now.
Right.
It's always too late. Whenever
I do have problems that I'm trying to fix too. To think about preventing this as a problem is just another layer. But I do chill every night. So to some extent, so there's no reason why I can't incorporate stretching into that.
Yeah. I have my stretches on the side of my couch. Yeah. And I also have free weights, just small 8-pound, 10-pound free weights on the side of my couch. Now, of course, my family does think I'm a little crazy in that respect, but I do it at least 3 to 4 times a week. But
when she lives to 148,
I don't know about that.
Who's going to be laughing?
That's right. Yeah. Whichever age I live to, I hope it's comfortably.
Yeah. Right. And that's the goal. It's not about how old we can get. It's about how, like, our longevity is living our best life. How long can I live well?
Sure. Yeah. The person that comes in and plays golf and they hurt their back and they can't go play golf. These people, this means quite a bit to them. Yeah. That might be their outlet for stress, and they can't do that. And we can help them get back out there, whether it be basketball, golfing, swimming, whatever it is, playing with your grandchildren, whatever the circumstance. It's, that makes everything worthwhile when you can see those people change.
But like you're saying, this is kind of clicking for me. A lot of people think chiropractic is chiropractic? Is that
chiropractic care?
Chiropractic care. Is chiropractic even a word?
I don't know.
Am I just making
I don't think it is because I've had a hard time with my captions recently. It's chiropractic care.
The only one. So chiropractic care is not I feel like a lot of people will think, I'm going to go in, get one adjustment, be good to go.
We do see that a lot.
That they think that?
Oh, absolutely.
Yeah. But it's like you got to either keep coming or do home exercises?
It depends what their goals are.
Okay.
And I have a very frank conversation with everyone. Some people get very angry when they come to see me and they say, no, just crack me. It's not how we do things here. You can go to someone down the road if that's what you're adamant about doing. If your goal is to just kind of get out of pain immediately and not fix the root of the problem, we're not the clinic for you. We're there to teach our patients long-term goals, health-wise, and,
And also I've heard that, you can move the bone, but it's almost like a muscle memory where it can shift back and it needs to be taught to stay.
This may not be the best analogy, but I tell people about dentistry. If you put braces on your children, and you're shifting the bones in the jaw, if you put braces on for one day, good to go. It's not how it works.
Yeah.
It takes time. Now, depending on the severity of the issues as well. Not everyone has the same course of treatment, of course, because we're all individuals, but usually not a quick fix.
Even if you have braces for years, get them to the point where they're good, and they're like, okay, take them off.
They'll still move.
They'll start moving. They'll do what they want, no matter what.
Our genetic makeup is there.
Do you have your permanent brace?
retainer?
Or permanent retainer?
No, I'm sad to say that I had braces before they even made permanent retainers. So I was going to have to wear my retainer for the rest of my life, which I stopped doing when I was in college. I did wear it for a long time. And now my teeth
look, they look good.
My bottom teeth are not straight.
Okay. So you're saying the result of not having a permanent retainer is here. I gotcha.
Yeah.
It's an analogy that people can relate to.
Yeah, for sure.
A good visual.
definitely
that
makes
makes sense,
So you mentioned earlier that you were crunchy before it was cool. How does that mindset seep into the way that you treat your patients? Does that affect it at all?
I don't necessarily know if it affects my patients, but it helps me relate to certain patients that feel the same way. And you will generally see, I'm sure in your practice as well, people gravitate towards the like-minded.
Right.
And I also love the people that, are looking at me like, I don't know about you, lady.
Yeah.
Those are great as well. But if I can help someone learn from my experience, even if it's small baby steps, those small steps can lead to very, very dramatic changes.
And sometimes it's just planting a seed. Like maybe they've never heard it before. You plant the seed. They're like, that chick's crazy. And then they go somewhere else. And now that the seed has been planted, they're going to hear it more often. Or the seed has already been planted. They come to you and you reinforce something that they've already heard.
Right. And like I said, when I thought about chiropractic school, there may have been 10 chiropractors. I think there might be 75 in Lafayette now, maybe 80. So, okay. So if crazy lady over here says this, and then I'm going to go to someone else. And generally we all, you know, have the same information.
Let's talk a little bit about dry needling.
Yes.
So what is the difference between dry needling and acupuncture?
And wet needling.
Is that a thing?
It is.
It is a thing. I was trained in acupuncture. You may have known that.
Yeah.
When I lived in Texas and I was in school there and getting ready to move home and practice, I decided to further my education and get certified in acupuncture. So in Texas, I was able to treat patients with diabetic issues, fibromyalgia issues. Wonderful.
Because of acupuncture or because of chiropractic care?
Both, but specifically speaking, acupuncture.
Okay.
And wonderful changes, relief for a lot of people. And then, of course, I moved across the state line to Louisiana, and I couldn't practice acupuncture unless it was under the guise of a medical doctor, that collaboration with a medical doctor. I didn't want to be under someone else's direction or license. And I needed to start my practice through chiropractic care more so. So I focused on that. And I actually had a few doctors come to me when they found out I was a chiropractor and an acupuncturist and said, hey, would you come to my office a couple days a week and do this? And I really wanted to, but at the time of my life, I was really trying to get my business started. It just wasn't feasible at the time. But I saw a lot of wonderful changes. And then all of a sudden, someone came up with dry needling. Same needle. You can appreciate that. Instead of contacting just the subcutaneous tissue or the skin and fat on the body, which acupuncture does, the dry needling goes into the muscle belly. So it is literally looking for a twitch in the muscle. And once that twitch happens, any kind of spasm or tension in the muscle, like we talked about earlier, the muscle fibers actually release. So there's a constant constriction in a spasm. And when the needle gets to the muscle, it releases that spasm.
So dry needling is it's the same needle as acupuncture needle, but it's going further deeper into the tissue.
Yes.
Okay. But the same things can be treated. I mean, you're treating essentially the same challenges, but you're just doing it in a little bit of a deeper way.
Yes.
Is that right?
And an acupuncturist can really answer, in that respect much better than I can, because that goes into the 12 meridians of the body in Chinese medicine. And I completely respect that, but it's been a while and I just don't even practice acupuncture. Now that it's legal for chiropractors to do dry needling, I've focused on that.
Similar, the response is similar. It's just called a different name. So that you can.
I feel like dry needling is maybe muscular, and acupuncture
dry needling is definitely
hitting the
contact
nerves?
with the muscle belly and causing that actual twitch in the muscle. Whereas acupuncture is just very slightly.
So those, what were those nerves you were talking about that are
the dermatomes?
Yes. More that.
Yes, and acupuncturists may argue with me on that.
Right.
But
scientifically speaking,
yes,
they're aiming to that. You're aiming to the deeper ones.
Yes, with dry needling, yes.
And
so have I confused you?
So who would go to you for dry needling? Like what kind of issues would someone come in and you say, you need dry needling?
Well, most recently, I have several dentists and dental assistants that see me. And
Jackie's response.
It's very specific.
It is because of the positioning that they put their bodies in all day long, every day. You wouldn't think so, but
that's crazy.
So
it's probably like a weird
absolutely.
Yeah.
I have a dentist that came in to see me, and he had done 4 root canals that day. And when he went to stand up, his back was in spasm. He was in excruciating pain, and he wasn't able to move. So he needed to go back to work the next day. And he came in and did dry needling, and
no kidding.
yes, it's amazing.
Literally didn't know much about dry needling until about a month ago.
Okay.
And my physical therapist, so I had some swelling in my heel from the surgery and like numbness, all this stuff. And he's like, we can try it. And I was like, go ahead, whatever works.
Sure.
And so I looked up a lot about it, asked them a lot of questions about it. There's a lot of different things it could be doing. But the next day, swelling gone. Blew my mind.
Increases circulation.
Yeah. It reminded the body, hey,
let's reset.
It needs a little attention
This is
there.
where we need to be.
And that's the biggest thing I learned. It's like your body. So it had been 2 months in surgery, and my body was like, here's your body now.
Yeah.
And we had to remind it, there's still stuff going on here. Get back to work.
Right.
And
send some blood. And
so
is it like a micro injury almost that you're trying to cause?
Yeah,
well,
kind of.
You do, yes.
Yeah.
It is,
So that's the point of it, is to create a little micro injury.
And also contact and get that muscle twitch. And it's very cool to see, because whenever you put the needle into whichever muscle you're contacting, you can literally see it move.
That's crazy.
So aside from dentist and dental assistants, what other reasons might somebody
oh my goodness.
come to you for dry needling?
Lots of people that do bodybuilding.
Okay.
Weightlifters.
For recovery purposes?
Oh, for pain.
For pain. Okay.
Pain. Lifting too heavy or malpositioning.
So injury things.
Injury things, yes.
Anything.
Yeah, you pull a muscle
Lots of
or anything
things,
like that.
pulled muscle. And, a lot of people put things off. They say, oh, pulled a muscle at the gym. I'm just going to, be back at it tomorrow. And that's not necessarily how the body heals. So,
But dry needling helped tennis elbow.
yes.
Ugh.
We found the solution.
Okay. I've been dealing with it for 6 months. It's much better, but it's still there. And I've started playing tennis again.
Hey!
And so,
Tennis,
yeah.
pickleballs, big popular thing now. So, and we also have a cold light laser at the office as well.
Oh,
so
no. What's that?
That could.
Yeah, tell us about that.
Well, back in the day when we first started out, there was ultrasound. I don't know if y'all are familiar. It's not, ultrasound like in babies. It's more of a therapeutic ultrasound. And that actually could increase circulation, decrease inflammation in the body. But the cold light laser can get much further into the deeper tissue and into the joint space.
Okay.
So that would work hand in hand with dry needling for something, depending on how severe it is or how long you've been experiencing it. Red light therapy is very effective and it's widely used now. Now, a lot of people do hear that and then they go on Amazon and buy a red light mask of some
I've done
sort.
that. It was like $30. Not legit.
Unfortunately. But this is more effective. It is more targeted. I wish I brought it with me. I could have shown you, but I believe myself and the UL football program are the only ones in the state of Louisiana that have our laser because of the effectiveness. Now, there are several, and I'm sure they're effective as well, but we really did our research before purchasing this and we went for training. Someone came here from New York who trained us and my staff, for several days on this modality.
What type of light is it? Is it a red light? Is it a...
It is.
Okay.
It is a red light. Now, it can also be turned to a blue light for, open wounds. But again, we don't treat open wounds at my office. However, it's been a great tool for people with plantar fasciitis, carpal tunnel syndrome, tennis elbow, those kind of things. Lateral epicondylitis, if you will, but that's tennis elbow.
Okay. I was going to say, is that the same thing? Okay.
Yes.
That's what you have. After wasting my money on Amazon with the red light mask, I actually did recently invest in a good red light panel. And it's been, my daughter has celiac and a friend of mine also has it. And whenever she gets exposed, she uses the infrared light panel to kind of help with the inflammation. And it's been amazing. I really like it. So I'm all about the red light.
Good to hear it.
Very cool.
Tell the others.
Never talked about wet needling.
Oh, okay. So what is
Do
red-
you do that?
No.
It's just the addition. You add medicine to the
You
dry
add
needling.
medicine to it. So chiropractors aren't necessarily
Oh, the
licensed
medicine
to-
part.
Mhm.
I see. Okay.
Because you would be injecting a fluid into the surface of the skin, into the body,
Yeah.
much like an injection of some sort.
Gotcha.
Which we're not licensed to
Stay
do.
away from that. Yeah.
Yeah.
Oh, very interesting. I didn't even know that was a possibility.
The first time I asked about it, I was joking too, and they're like, "Well, actually," I'm like, "Oh, well, that's crazy."
Yes. There's a reason why it's called dry.
Right.
Yes.
That
To make
makes
sure.
sense.
Yep.
That makes sense. So do you do any other modalities besides the laser, the dry needling, and acupuncture? Do you have other services in your office?
We do have a massage therapist on staff.
Ooh.
So she's been a wonderful addition. And as we know, massage and chiropractic just go hand in hand. I love my massage therapists. They're great. And it's wonderful to be able to, because I don't necessarily have all the time
Mm-hmm.
to spend on muscle work, which is so needed.
Mhm.
So I can diagnose. And when that person needs more muscle work or massage, I can send them to her.
Is there like a time, like, okay, so you get an adjustment. Can you not see a massage therapist for a certain amount of time after? Do you?
It certainly depends on the individual and the injury.
Mm.
If it's maintenance care or, the person is just having, some tight muscle spasms in the back or neck, there's really not so much of a time frame. However, if it's a motor vehicle collision, which we do see many
Mhm.
of those cases, we'd have to wait and make sure it's safe for that individual.
The reason why I ask is because a year or so ago, maybe longer actually, my husband, he had C6, C7, a bulging disc, I guess, for lack of a better term. We didn't really know what his problem was. He just had neck pain and he had some numbness going on in his arm and all the, textbook stuff. So he did chiropractic and deep tissue massage, probably one day apart.
Mm-hmm.
And it made it worse.
Mhm.
I think we got overly aggressive, not realizing what the problem was. And so I was very curious about if you should space those things out to maybe give your body time to heal.
Sure. If there was someone suffering with a disc herniation or numbness down one of the extremities, we would definitely not recommend a deep tissue massage, possible muscle work, muscle massage movement, a sports massage, if you will. But you have to work with the individual symptoms. There's no cookbook.
Yeah, I think we were self-treating at this point, so
I hear that a lot.
It was not advised.
Yeah, I hear that a lot. And usually I am the last person people come to. They'll say, oh, I'll try to self-medicate at home. And when that doesn't help, they'll try to explore other avenues. And then when they realize, okay, I've just been taking these pills for 3 months, nothing is healing. That's usually when I see them. Sometimes with a raised eyebrow. Yeah. But again, I like those because...
But I think if you're their last stop, that means that you've helped them and whatever you've done has worked for them because they're not continuing to seek care after that. So
that's the goal.
Take that as a compliment.
That's the goal. Yeah. That's what we try to do. So
obviously we have not gotten to everything that we want to talk about. So that just means you're going to have to come back on again later.
I'd love
but
to.
We're running low on time. So something that we ask every single guest before they leave, before we allow you to leave.
Okay.
What does living vividly mean to you?
My goal is to live a full life. I would want to work towards a very stable, healthy balance of mind, body, and spirit. Homeostasis, if you will. Mental well-being, physical well-being, but also spiritual well-being, whatever that means to you. But for me, a healthy balance, I think, is what we would all work towards to have a full, vivid life.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.